South Africa has recorded over 32,000 COVID-19 cases, according to the Health Department's latest figures. The Western Cape still leading the pack with over 21,000 cases, followed then by Gauteng. I'm joined now by Adrian Puren from the National Institute of Communicable Diseases, just to discuss the latest information we have and what we can glean from the data at our disposal. Professor Puren, thanks as always for joining us. Talk to me about the initial R. Now, from what I understand, in South Africa, that was estimated between 1.7 and 2.5, resulting mainly from transmission of infection from international travelers into South Africa. That now seems like a long time ago. Where is that initial R at right now? And explain to us what the initial R is.
So when that first traveler arrived, or those travelers arrived, and coming with that particular infection, our whole population was susceptible. That's what is called the R0. So it's the rate of transmission from one infected individual to susceptible individuals. And it ranged, as you said, from 2, in fact, it can go up to levels of 3. Once you have community of spread beyond that, and you also have your interventions that we've had, such as the lockdown, the emphasis on physical distancing, the hand hygiene, the wearing of masks, then we talk about what is called an effective R, because not everyone then is susceptible or has some level or degree of protection. So we really call that the effective R. So when we started off, we had those levels in the different provinces, and we in fact normally had a national level of R, about 1.76 to about 2. But now we have sufficient data for at least 4 of the provinces where we can actually look at the individual R. So as we approach level 3, the concern is we've got these 8 million people all on the move, on the go. We've certainly emphasized around physical distancing, the wearing of masks, the hand hygiene, but we will inevitably see cases happening. And as you know, we're going to review this in 2 weeks, and that R, then the effective R becomes really critical for the different provinces and within those particular provinces, especially areas where there are infections above 5 per 100,000, for example. So if you look at the R and look at that trend of R over time in the different provinces, we can see that in the Western Cape there's a stubborn trend above 1 and 1.5. What you'd like to see is that R goes below 0, below 1, for example. So you'll still have transmission, but the rates of transmission will be far lower. If you look at the Western Cape and the Eastern Cape, the R is between 1 and 1.5. If you look at KwaZulu-Natal and Gauteng, we can certainly see that the trend of the R certainly approaches 1. The transmission is occurring, but not to the same extent as we've seen in the Western Cape and in the Eastern Cape.
Now, we're talking to you today as we start a new part of this lockdown as the country heads into lockdown level 3. Some kids are going back to school in some provinces, but many more people are going back to work. This morning, for the first time, you could hear the wheels of public transport across the city here in Johannesburg. It's expected that because of this movement, when people move, we've been hearing the coronavirus moves as well. Just explain to us, in the relaxation of the type of lockdown that we've had, how important is those sanitation precautions that we've all now learned so much about? And more importantly, how important is social distancing, even as the country starts moving again?
So these are critical. So that gives meaning to that R. That R is about the individual who is infected, and it's about the individual who is susceptible. So the individual, what is our rates of transmission? And in the case of those who are susceptible, what is the rate of exposure? So those are the critical things that give meaning to R is when we talk about the physical distancing. So we talk about 1 or 2 meters distant from an individual. That's good. It could be better. And that's really critical. Similarly, with the hand hygiene, the washing of surfaces, those are really critical. And those factors are taken into account when we actually calculate that R0, because those are the factors that will tell us about whether or not the infection rate is actually increasing, or in fact we are actually controlling it. So employers, employees have a great deal of responsibility. There needs to be clear protocols, clear guidelines about how we're going to manage a person who presents with an infection. So again, I want to emphasize I know that there's a great deal of asymptomatic spread of this particular virus, but we cannot and should not be forcing people to be tested if they do not present with symptoms, because we have limited resources around testing. We should really focus around individuals who are presenting with symptomatic symptoms, for example, in terms of fever, cough, shortness of breath. They must stay at home, see their doctors, see their GPs, and get tested on those particular circumstances to prevent the transmission of the virus. So the protocols are really essential.
Professor Puren, always a pleasure speaking to you, reiterating again the importance of social and personal distancing, and that hand sanitation is all important. Thank you so much for your time. Professor Adrian Puren from the National Institute of Communicable Diseases joining us live there.